questions. Question number 1. Distal pole of scaphoid is most common to go AVN. Wrong. Blood supply is retrograde. True. So assertion is wrong. Reason is true. D. Stability to posterolateral corner, which is a very, very important corner of the knee joint, is provided by the structures on that side, like the biceps femoris, the arcuate ligament, the popliteus tendon, the lateral collateral ligament. Hamstring is not an important contributor. So the answer is hamstring here. AVN is common at which of the following sites? Head of femur, yes. Apart from that, it's not common anywhere else. A 45-year-old male with history of fracture neck femur develops AVN on the femoral head. Which artery is responsible? So it is the retinocular branches of the medial circumflex artery which is responsible. X-ray sign of ACL injury, just on the lateral tibial plateau there can be a chip fracture called as a C-gone fracture. Painful arc syndrome, mid abduction is painful, 60 to 120 degrees. Identify the deformity. This is mallet finger. Hagelund deformity involves around the ankle, the heel more specifically. A young boy presents with a swollen knee, getting a hit over the lateral aspect of knee while playing. Anterior draw 10 was negative. X-ray shows no fracture. Which structure is damaged? Remember, in a valgus force which is given here, the important structures which can be damaged are medial collateral, anterior cruciate ligament, medial meniscus. So valgus plus rotation. When both are given, the first thing ACL. Apart from that, the second thing medial collateral ligament. Third is medial meniscus if the combined forces are given. So when they just give you valgus, think of medial, then ACL, then meniscus. Valgus and rotation, think of ACL. In this order, medial collateral ligament, then medial meniscus. ACL, anterior draw is negative. It's out. MCL is not in the option. So your answer will be medial meniscus. Potential causes of avascular necrosis: steroids, Cazen's disease, sickle cell, hip dislocation, fracture neck femur. All 5 are correct. Identify the abnormality shown in the following picture. This is hallux valgus. Root value of sensitive supply of thumb and index finger, C6, C7. 50-year-old diabetic alcoholic, classical dependence, presents with 15-degree deformity. Appropriate management, wait and watch. If the joint is not given, you'll take it MCP and the cutoff is 30 degrees. AVN can occur at all except femur neck. AVN involves the head of femur in the fracture neck of femur. Body of talus, proximal scaphoid are sites of avascular necrosis. True about AVN of the femur. Affected side allow hip weight bearing? No. Asymptomatic cases may occur? True. The radionuclide scan may show increased uptake around the area of infarct? True. Trendelenburg test is negative. So when you have avascular necrosis, in terminal stages, it can be an unstable. So Trendelenburg test can be positive, false. MRI is IOC? True. So the answer is B, C and E. No man's land is flexor zone? 2. Decurvence classically affects abductor pollicis longus, extensor pollicis brevis. Which of the following is false regarding patellofemoral syndrome? Pain on posterior aspect is not true. Pain will be there on anterior because patella is anterior. Best results after meniscus. Blood supply comes from outside in, so it is the red zone, the outer zone. A female has a backache. This prolapse which nerve root? So this is L4-5 disc. So L5 nerve root will be involved. So this is about sports injury and neuromuscular disorders. Thank you.